Hi everyone, welcome back to Forward Therapy. My name is Kelly Troutman and I am a certified hand therapist. Today's video is part 5 of our 7-part series of treating wrist tendinitis. So if you've missed the first 4 parts, I'm going to post those videos in the comments below, in the description below, so go ahead and check those out if you have not. The video today is called To Brace or Not to Brace. And without further ado, let's get into it. So, to brace or not to brace? I am of the belief that a brace can actually be helpful for people with wrist tendinitis, but I do believe that it also can be detrimental if it is worn too much or for too long, because people will become atrophied, they'll become dependent on the brace, they'll become deconditioned, and that actually can escalate their symptoms or create further problems down the time of their life. And so what I typically do in terms of bracing or splinting options, if their case is very acute, right? So if they've had the symptoms for maybe, less than a month, a very short period of time, I usually recommend they wear that brace for 3 to 4 weeks of most of the time brace use, just to let the tendons rest, see if we can't get on top of the inflammation, and see if we can't give the tendons a little bit of a jump start in healing. Just trying to settle the system, right? Give that tissue a break. See if we can retrain them to do their activities a different way, that kind of stuff. Then, after that 3 to 4 weeks of most of the time use, I will recommend they continue to use the brace at night so that they don't sleep on their arm in a funny position and again make the symptoms worse. Just trying to give the tendons a little bit of a break, a rest while they're not active during their day. But they can usually wear it during the daytime, during activities, as long as they're able to do their ergonomics, their activity modification, those things that you've already educated them in. Some cases, they need to wear it during some of their activities of daily life too, right? For instance, moms that have Decker veins or dads that have Decker veins, it is often really difficult to modify all of their activities to avoid use of the thumb. And so I do find that for some of those people, they need to use a brace for a little bit longer until maybe baby is walking or crawling and they're a little more independent, and they're not having to do all of these small delicate childcare tasks, but also the lifting constantly and holding and nursing and all that stuff with the baby. So again, I think it's really truly dependent on your patient, obviously. And some people need to be in a brace a little longer. Some people need to not be in a brace at all, because if you immobilize them, they are just gonna start to depend on the brace. They're going to start having central sensitization. They take the brace off and they just can't even have their hand out of the brace without having pain. So you don't want that to happen for people either. So, you really have to get a full thorough history. You need to know your patient, know the words that they're telling you, listen to what they're saying, because they'll tell you what you need to know. Are they having out of proportion pain? Are they somebody that seems really anxious and like they're not gonna, they're gonna be really guarded? If you let them wear a brace, they're just gonna depend on it forever, that kind of stuff. So, you got to be cautious. You definitely want to make sure that the patient is going to deal with that well. But I do think that there's definitely a place for bracing or splinting with wrist tendinitis in particular. You can also use kinesio tape if you know that there's somebody who needs, maybe some proprioceptive cueing or a little bit of support, or to help settle the nervous system or the sensory system, or, you found that maybe they just like the way that that feels, gives them some decompression, helps with the inflammation, whatever you're trying to do. It gives them some proprioceptive input, some feedback, so they can pay attention to their posture and their activities that they're doing. It maybe pulls the skin a little bit when they try to go into the positions that you're trying to have them avoid. And it gives them a lot of support as well. I do tend to use kinesio taping a fair amount. I find that especially for people that have Decker veins syndrome, a lot of those people do not tolerate braces very well, because With thumb spicas, unfortunately, a lot of times that metal bar is like right along the first dorsal compartment, right at the radial styloid, and where the sensory branch of the radial nerve is really sensitive. A lot of times that brace seems to irritate them or press on them there, and they can't tolerate it very well. Some people are just not willing to use a brace because, especially in the case of like mommy thumb, right, or mommy wrist or daddy wrist, um, they're worried about the baby's comfort. So they don't want to hurt the baby. They feel like maybe the brace is just not comfortable for the baby to be near them, and they're delicate and all that stuff. So tape is sometimes a really good strategy to try with them, and there's a lot of good taping options out there, and you can find one that works well for you and one that you prefer. Certainly, it's a great idea to take like a taping course if you can, to get some good ideas and some education there. But that can also be a really helpful strategy that I've used on some of my patients that have tendinitis. Helps with pain management. You want to be sure you know what you're using it for. Are you using it for inflammation? Are you using it for joint positioning or stability? Are you using it more for like sensory system settling? So maybe you're doing some very light, cutaneous kind of taping to support that. It'll kind of give you that idea of what you need to do. So yeah, I would highly recommend, taking a course on taping in general if you can, or looking out for information from certified instructors. To brace or not to brace, it depends. I definitely use it as part of my treatment plan often, but not always. And I would say you have to weigh, again, the pros and cons of each patient's symptoms, their personality, their pain levels, and kind of find that happy medium. In general, I think, we can't have one protocol to fit every single person, but in general, I would recommend if it's acute, 3 to 4 weeks of most of the time use of the brace, and then alternating or switching to just nighttime use for about another, 6 to 8 weeks, or until the symptoms are calming down a little bit more, getting more manageable. Some of those people will have to deviate from that plan, but that's kind of a good solid general idea that you can follow, and then deviate based on what your patient's needs are. So yeah, I hope that video was helpful for you. If you have other positions or ideas on using braces, I would love to hear them in the comments below. Please share anything you can so that we can all learn and grow as a community and make our profession stronger and help our patients even better. So I hope you enjoyed this video. Thank you so much for watching, and we'll see you in the next one.